We live in Monroe, New Jersey. We've been married over 40 years.
We have 2 daughters. Our older daughter has 2 children, a boy and a girl, and our younger daughter has a girl and is expecting a boy in a couple of weeks. Around November of 2017, I was starting to see some blood in the urine. What was very shocking to me, my first shock for this whole thing, aside from seeing blood in the urine, is that my urologist said, "You need to see an oncologist." And that was like, what? Around April of 2018, my urologist suggested, "Your PSA is rising." I had some blood work. My PSA rose to 5.6. So I started really getting concerned that it's really going in the wrong direction. I went to probably at least 4 different major cancer centers. And so I decided I was comfortable with going to this place here in central New Jersey. It actually gave us the conclusive news that I definitely had metastatic prostate cancer. At the very beginning, I was told, I am terminal. There is no cure, but I just immediately thought, boy, I've got to get to work. I have to see what my options are, and let's get going. I had to do a lot of research, a lot of questions, a lot of second opinions, and a lot of discussions with the various support groups that I attend on a regular basis.
I had a very hard time dealing with it. My husband wanted me to go on all these support groups. He's on a lot of different support groups.
I've learned early on from one of my support groups, and their mantra is that you are your own best advocate. I also subsequently had genetic testing, which was really important, and I would encourage all patients to have genetic testing. I think more and more now doctors are doing it as a normal course of treatment. I met my current oncologist at this major cancer center in New Jersey, and we talked about a clinical trial. So this was the first time clinical trial was discussed. I had always thought originally that clinical trials were to be considered when you really don't have any options, but that really couldn't be further from the truth. The trial was to determine standard of care versus standard of care plus having robotic prostatectomy. I had my prostate removed robotically. They had a tissue sample that was sent on to a center, and the result was that I had several genetic mutations. I was identified as being BRCA2 positive. And typically BRCA2 is something that is identified and publicized for women who have breast cancer and ovarian cancer.
The second struggle we had, our kids had to get tested, and finding out that both daughters had BRCA2.
Both our daughters have that mutation, and the likelihood of them getting breast or ovarian cancer is pretty high.
One of the positive things about my husband having prostate cancer is in a way that saved the lives of my children, because they're able to take care of what has to be done. I go back and forth. Like, there are times I know my husband wants to lose weight because he wants to be healthier for his treatments. Then I'll see him eating some ice cream or something, and I'm saying to myself, let's just enjoy whatever we can now, because who knows what tomorrow is going to bring. And then sometimes I'm thinking the other way, maybe we should do all this to help have our tomorrows.
You know, the priorities are clearly different now than they ever have been, and living for the now is the key. We've been to the Berkshires not that long ago, taken advantage of Tanglewood. We love to go to Point Pleasant. We've gone with our children and grandchildren.
In April, we went to the Shenandoah Valley area, which was beautiful. So we like to keep busy. We're in a lovely home, in a lovely neighborhood with nice friends, and that's enough.
For me, what's helping me manage the stress and the anxiety is Hearing other people's stories and contributing to other people who ask questions, I'm really happy that I'm able to help other people in their journey as well.